Hello, I'm Dr. John Ebner, originally from Arizona. I went to medical school here at Midwestern University and completed my residency at the Cleveland Clinic in Ohio. There are three major types of skin cancer that we deal with in dermatology, and those are basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most common skin cancer, or the most common cancer known to man. We see cases of this on a daily basis in our practice, as well as that of squamous cell carcinoma, which is the second most common cancer. Both of these cancers are absolutely involved with sunlight and sun exposure over decades. Melanoma, the third most common type of skin cancer, is often the most deadly type of skin cancer, but when caught at a very early stage is very treatable and almost 99% curable. However, many times we see patients with advanced melanoma and the prognosis for them is much less. When treating skin cancer on the head and neck region, we treat basal cells and squamous cell carcinomas with a special technique called Mohs surgery. It's actually named after Frederick Mohs, who developed the technique in the early 1930s, and over the past several decades it's been refined significantly, and now we can perform it in an outpatient setting in our office. The patient comes in the morning, and we take out a piece of tissue that represents the clinically obvious part of the skin cancer, and it's processed in a laboratory here on site so that we can evaluate the skin cancer and all of its margins under the microscope. Doing this, we can see the entire margin, that's 100% of the surgical margin, taken out and see whether or not skin cancer remains inside our patient. If there is skin cancer that remains, we only need to go back in and take a very small section of the skin to remove the rest of the skin cancer. This results in the smallest defect possible and total clearance of the skin cancer. For a primary initial basal cell carcinoma, the clearance rate is 98 to 99%, which means that only 1 to 2% of the cases ever come back when this surgery is performed. Using this technique for squamous cell carcinoma, the clearance rate is roughly 96 to 97%, which means that only 3 to 4% of the cases ever come back using Mohs surgery.